The Boston Marathon on Monday. The next 48 hours require plenty of carbs, water, and sleep.
But what about after the race? Well, here with some advice is Dr. Adam Tenforty, the director of running medicine for Spaulding Rehab at Mass General Brigham. You were an All-American runner at Stanford, so you really understand firsthand the importance of recovery. What tips do you have for someone who just finished a maybe 5K or even the 26 miles on Monday?
Well, first off, I think it's important just to enjoy the fact that you've completed an event that you've been training for. And the goal is that after the event, you can also recover so that you're not feeling the ill effects of the race. So in the more acute phases immediately following the event, the important thing is first and foremost, after you cross the finish line, keep moving. There's oftentimes a lot of race personnel there that keep people moving through the chute, and that's because when people stop too quickly, they oftentimes have acute changes in blood flow, and it makes it difficult once you go down to get back up. Hydrating, taking a space blanket, other ways to just keep moving and to prevent the kind of ill effects around weather are really important. I think once you have an opportunity to take a warm shower, change into some dry clothes, and then if you have someone who can, help you with something like a light massage, I think that can be really helpful. Aggressive stretching or doing, an extreme exertion is really not what's advised. But also making sure you're hydrating, getting great nutrition, having a good night's sleep after the event. Those are really important in the early stages of recovery, along with making sure that you're regularly urinating so that it shows that your body is properly hydrated and you're not seeing any ill effects to your kidneys, which sometimes happen with extreme stress.
Most runners expect their muscles to be sore after a race, especially a long one. Are there other symptoms that you would call normal here, and how long do those aches and pains typically last?
So having run Boston 6 times, there have been some years where I feel great right after the event and other times where the weather is more extreme. So you just have to recognize it can be very unpredictable how your body will respond to the stress of completing the marathon or completing any type of road race. So up to 48 to 72 hours, you can develop something called a delayed onset muscle soreness. And that is a healthy and normal response to your body essentially actively working to repair damaged muscles and tissue. So having some generalized soreness is not abnormal. The things that would be concerning that would really require medical attention is if you're having an area of pain that's getting progressively worse as you move, where you're limping, I would want you to see a medical provider such as one of the wonderful individuals that's part of Mass General Brigham Sports Medicine. I would also advise, thinking about, other things around hydration. The main concern is that if you're dehydrated, you can sometimes have some problems with your kidney and general muscle soreness, and that also requires more urgent medical attention. But if you're continuing to hydrate and continuing to urinate, then you're probably just fine. And it's really just working through some of the post-exercise soreness by remaining active.
Thank you so much. It's good to be able to decipher, just a little pain in a serious condition. Dr. Adam Tenforty, the Director of Running Medicine for Spaulding Rehab at Mass General Brigham. Have a great weekend.
Thanks for having me.
So much.